Hello and welcome to our introduction to chronic inflammatory response syndrome. So in this module, we're just going to be talking about, what it is, what it looks like inside of our body, how does it unfold, how do we get sick in the first place. So we're going to just be diving in to the basics, but I think this is incredibly important to know. And this is a great module to share with our friends and our loved ones who might be having a hard time wrapping their heads around this illness and why it is that we're struggling as much as we might be struggling. So diving right in. So what is chronic inflammatory response syndrome? Well, I like to say it's exactly what it sounds like. Chronic inflammatory response syndrome is a chronic inflammatory response that's going on inside the body as a result of ongoing exposure to biotoxins. Now, as these biotoxins get in our body, and in a minute you're going to be learning about why they get stuck in some people's bodies and not necessarily everybody's, but once these toxins are inside our body, it leads to this chronic inflammatory response. Like the body becomes overwhelmed and inflamed, and it's not just the body, it is also the brain, and that is usually what results in the majority of the symptoms that people experience with chronic inflammatory response syndrome. So we use the word biotoxin. So what is a biotoxin? Well, a biotoxin is a toxin that comes from any kind of living source. So for example, mold would be a source of biotoxins. In fact, we refer to these as mycotoxins, and these molds are oftentimes found within water damaged buildings. But guess what? Mold is not the only source of biotoxins. It turns out that bacteria can also release biotoxins. And in fact, if you've ever heard of somebody who has chronic Lyme disease, and certainly you have, and in many cases, a lot of people who have, chronic inflammatory response syndrome, once they realize like, well, yeah, I was diagnosed with Lyme. Well, that's not a coincidence. So chronic Lyme disease is in fact a form of chronic inflammatory response syndrome. It just came from the bacteria associated with a tick bite or potentially even a spider bite. And turns out viruses can also release biotoxins and therefore trigger chronic inflammatory response syndrome. So again, if you've heard of somebody with Epstein-Barr syndrome, or guess what, even long COVID, it now turns out that long COVID is in fact a form of chronic inflammatory response syndrome. Again, this time it was just triggered from a viral, a viral infection as opposed to, say, mold. So a biotoxin, anything toxin coming from a living thing, that can be molds, that can be bacteria, that can be viruses as well. So let's talk about what is the problem. Like, where does this all become an issue? Well, first off, I think it's important to recognize that there is a huge genetic component to chronic inflammatory response syndrome. In fact, it's estimated that up to 30% of the population is at risk of biotoxin sensitivities and therefore biotoxin-related illnesses like chronic inflammatory response syndrome. And now, just because someone has the gene does not necessarily mean that they're going to be sick. The genes have to at some point be turned on. And this genetic component, it makes a lot of sense of the illness in itself. This is why not everybody who is exposed to water damaged buildings and mold, for instance, don't get sick. And in fact, I like to give an example of if you took 100 people and you put them all in a moldy building, well, right off the bat, 70% of them will likely never have any symptoms. And then amongst the 30% who might have the genes, well, even within the genes, there are varying degrees of sensitivities. So let's just say of the 30%, or of the, we put 100 people in, 70 of them are never going to get sick. Well, of the remaining 30, let's say 20 of them, maybe they get a little headachy, maybe they get, maybe they're a little fatigued, maybe got some allergies, stuff that can pretty much easily be swept under the rug. But then you've got the 10% who are absolutely devastated by this illness and actually have symptoms that are disabling, like severe chronic fatigue and brain fog and pain and anxiety and depression. But, good luck to those 10 people to trying to convince the other, 90 in the same room that it's actually the room that's making them sick. That's one of the major challenges here. But so there's a huge genetic component. 30% of the people out there, we have a predisposition towards biotoxin-related illness. Now, when you combine that with the fact that, look, there's an estimated 60 to 80% of all homes and buildings are considered water damaged. And, having been in this field for nearly a decade at this point, it's like, I think that's an understatement. An underestimate. It's like, show me the home that has never had a leaky faucet or, too much humidity in the basement or a leaky HVAC. It's like, it is so widespread. The reality is that, most of us consider that most buildings and homes are actually safe and mold free, when in fact, given the percentages, I think the better assumption is to assume that all buildings are water damaged unless otherwise, proven, otherwise. So this is a massively underdiagnosed illness. We're looking at, when you just do the math, it's like, okay, 30% of the population is genetically at risk. 68% of all homes and buildings are water damaged. I mean, we're looking at nearly 40 million people who are being misdiagnosed, being told they've got, chronic fatigue syndrome or fibromyalgia, or I've even seen cases of neurodegenerative things like Parkinson's and MS. I've even seen cases of ALS where people recovered, once they got out of exposure and were detoxed appropriately. What they really had was chronic inflammatory response syndrome. I think this is a huge source of frustration, and there's no doubt you've likely experienced this, especially if you've been sick long enough, because most people with chronic inflammatory response syndrome, oftentimes they look healthy. Oftentimes they're already living much healthier than most people just to try and manage their symptoms. And then typically most of their labs look normal. This is a huge form of gaslighting that happens in our medical community, where we're basically told, hey, everything's normal, like it's all in your head. Maybe have you tried anti-anxiety medication? Have you been on an antidepressant? And I mean, this is so unvalidating, because it's like, well, no doubt we're experiencing anxiety and depression, but that's not what's going on. Like, that's, not the root cause. Like, something's causing us to have those experiences. So we're either going misdiagnosed or we're going underdiagnosed. And, the truth is that, chronic inflammatory response syndrome is far more common than one would ever believe. It's just, it is happening all over the place. And I think that once you recognize in yourself what's happening, you're going to be able to see this in other people who might not even recognize it in themselves. Well, ironically, sometimes we even have people who don't, who have a hard time grasping this illness in us, and yet here they have it as well, but they're just not able to necessarily see it. So at the core of this, chronic inflammatory response syndrome, it all begins in the brain. So, once the genes get turned on, once these genes get triggered, so there's a triggering event, there's some kind of biotoxin related exposure, throw in like some major life stressors, like, a divorce or a move or losing a job. You can even toss in like a physical injury, a car accident, a concussion. Like, when we have a variety of events all happening at once, that's what turns these genes on. Once the genes are on, our body loses the ability to detoxify, and boom, now we start getting inflamed. But it's our brain that's getting inflamed with literal neuro or brain inflammation. Now, when the brain starts to get inflamed, well, the brain, it controls everything down the stream from there. So once the brain starts to get inflamed, all of our other body systems start to be impacted, like our digestion and our immune system and our circulation and our hormones and our nervous system, musculoskeletal system. Like, boom, this starts becoming so widespread throughout the body. And this is ultimately why we refer to this illness as multi-system and multi-symptom, because it impacts multiple of our body's systems, resulting in all kinds of weird random symptoms popping up. So, I mean, it's virtually impacting every system, potentially every system in the body, leading to a wide array of what is seemingly random symptoms. When, again, if you were to just trace, that the breadcrumbs back, you would find that, in fact, it's all coming from the brain. And then, of course, this is what makes this so hard to diagnose and treat, is just the way our system, our medical system is put together. It's like everything is just like looking at individual systems. Nothing's looking at the whole. So it's like, well, we end up going to a GI doc for our heartburn and indigestion, and cardiovascular doc for our heart palpitations and high blood pressure. And, maybe we're seeing an endocrinologist for our hormonal imbalances or our blood sugar imbalances. And, so it becomes really challenging. And this is, again, one of the problems is that, I'm 100% convinced that most doctors, we are not taught about this. I don't care if you're a medical doctor or a DO or a chiropractor or naturopath. No doctors are educated on this. I'm convinced the only doctors who get this are doctors who were actually sick with this and they were forced outside of their box. So, hallmark symptoms. Now, as you probably know, it's there's a whole array of symptoms associated with chronic inflammatory response syndrome, but there's about 5 or 6 symptoms that are consistent with brain inflammation. And so these are what I like to call the hallmark symptoms of brain inflammation or chronic inflammatory response syndrome. Number 1 is going to be cognitive dysfunction, so brain fog. It's like loss of short-term memory, inability to concentrate, focus, learning new information. Cognitively, it's we lose our ability to organize and plan and be on time. Even things like simple, if this gets bad enough, things like simple math becomes really, really challenging to do. Of course, the fatigue is a huge factor, and this oftentimes leads to people being diagnosed with chronic fatigue syndrome, but fatigue is a hallmark symptom of neuroinflammation. Chronic pain, so we start to develop pain in our muscles, our joints, we get headaches. Of course, this one oftentimes get diagnosed as fibromyalgia. And again, ironically, chronic fatigue syndrome and fibromyalgia, they're kind of these junk diagnoses. Nobody knows what it is, and they don't really know how to treat it. It's kind of well, if you're tired all the time, we can't find out why, you must have chronic fatigue syndrome. Or, if you have pain all the time, we can't figure out why, you must have fibromyalgia. When in fact, again, this all gets traced back to the brain inflammation that is resulting from chronic inflammatory response syndrome. Anxiety is going to be a huge one, and depression. So, those are the mental emotional, but I've even seen this show up as, PTSD, ADHD, OCD, all kinds of mental emotional disorders can result from brain inflammation, which of course makes sense. So those are the big 5, brain fog, fatigue, chronic pain, anxiety, depression. But of course, that's not all, but our biggest concern here, our biggest long-term concern with chronic inflammatory response syndrome, all the other symptoms aside, is that ongoing brain inflammation is linked to Alzheimer's and dementia. And in fact, this has even been referred to as inhalation Alzheimer's. So if you're familiar with Dale Bredesen's work, Dale Bredesen wrote the book, The End of Alzheimer's. He did an amazing job laying out all the root causes of Alzheimer's and dementia. And in here, he links to research associated with chronic inflammatory response syndrome, and that mold and biotoxins are in fact a root cause of dementia and cognitive decline. So again, that just makes it so much more important that we catch this early on, because it will just keep getting worse and worse and worse. And good news, brains heal. We see it happen all the time. So let's just talk about some of the other systems that get hit. So our immune system becomes dysregulated. So we're more prone to getting sick, colds, flus, COVIDs, things like that. A lot of people find they have a harder time recovering from illness, but of course, this will also eventually lead to all kinds of autoimmune related diseases. So Hashimoto's, so thyroiditis, you've got the celiac and Crohn's and colitis and lupus and scleroderma. I've seen cases of all of these, be reversed when people start addressing, get a proper diagnosis for chronic inflammatory response syndrome and actually get treated. Now, a lot of folks with chronic inflammatory response syndrome, it starts to impact other parts of the immune system. So they develop things like histamine intolerances. So all the foods they're eating can cause inflammation flare-ups. Even mast cell activation syndrome, a lot of doctors out there are treating these as if they're their own thing, when in fact they're oftentimes just a symptom in and of themselves of chronic inflammatory response syndrome. Of course, I mentioned the endocrine system, so hormonal imbalances, thyroid issues. This is going to lead to problems with our sex hormones, estrogen, progesterone, especially testosterone, causing people to just be tired and lethargic and flat, increases weight gain. Melatonin happens to be a hormone that gets impacted, so we struggle to sleep. Our respiratory system, we can get shortness of breath, we can get a chronic cough, we can get asthma. And again, one of the challenges here is no two CIRS cases present identically. Like, everybody's unique in the different parts of the systems that get impacted. Cardiovascular system, so we get heart palpitations, changes in our blood pressure, dizziness. Guess what? POTS is very common, and it just so happens that it is another symptom of chronic inflammatory response syndrome. And the challenge here is that so many people, they get diagnosed with POTS, and then they get treated for POTS, but again, none of it is addressing root cause. So then we've got GI issues. So the nausea, the abdominal discomfort and pain, the bloating, food sensitivities, leaky gut syndrome, constipation, diarrhea, all can be a result of chronic inflammatory response syndrome. Continuing on, musculoskeletal system gets hit, joint pain, muscle aches, headaches, muscle weakness, nervous system. We can get numbness, tingling in our hands, our feet, our face. We can even get tremors and tics. It hits the skin, especially with the histamine intolerance. We get rashes, we get hives, we can get itching, impacts our vision, light sensitivity, blurred vision, frequent urination as it hits our urinary system, and frequent thirst and dehydration. So truthfully, like, this can be such a profoundly impactful illness in the sense that it hits so many of these different systems. And again, we just end up being nearly disabled all said and done. And again, doctors are just completely baffled. So when it comes to diagnosis, again, it's really challenging to do unless you know what you're looking for. But, one, we've got to have a known exposure to biotoxin. And then we combine that with symptoms consistent with chronic inflammatory response syndrome. And we combine that with a failed VCS test indicating neuroinflammation. Then we would finally follow that up with a blood panel that you'll learn more about in future module, but to get a really clear diagnosis of chronic inflammatory response syndrome. So what do we do? Well, here we go, protocol. It is a systematic approach to treating chronic inflammatory response syndrome. So Dr. Richie Shoemaker, complete brilliant genius, is the guy who discovered this illness, and over the last 30 years has been constantly developing and redeveloping and evolving the Shoemaker protocol. But and again, I'm going to be getting into that in step by step in a future module. But just to give like a holistic overview, the key steps. Step number one is just removal from exposure. You can't recover from an illness if you don't address the root cause. We've got to get out of exposure. Now, for those of us who have the genes that have been turned on, it's like, well, our body's not going to be able to naturally detoxify. So then we go through a detoxification process. And then once we're detoxified, the next step is about shutting down that inflammation before finally we can come in and actually heal the tissues that have been damaged from ongoing inflammation throughout the brain and the body. And yes, I mean specifically healing brain tissue. It can happen. All right, so in conclusion, what do we know? Chronic inflammatory response syndrome, it's complex. Like, it is a multi-symptom and multi-system condition. Like, it is potentially impacting all of our body's systems. And, it's driven by brain inflammation. That's where all of this starts. When the brain gets inflamed, it starts damaging tissues in the brain that are responsible for very important downstream hormones that basically run all of the different systems in our body. And of course, that's going to result in a huge, wide-ranging, symptoms and effects on our health, and eventually can lead to pretty severe disability. And of course, in the long run, dementia and cognitive decline. So once again, I mean, this is why it is crucial to work with people who understand what this illness is. Otherwise, people are just constantly going to be throwing darts, hoping that something they try works, when in fact, there is a protocol that works great for people with chronic inflammatory response syndrome. And in fact, I'm convinced it works every time, provided we get through each and every step. So, overall, I think it's just so important to understand how this illness works, how it unfolds, how it impacts the body. Like I said, this can be a really useful model to share with your loved ones, your partners, your friends, your family, if they're having a hard time understanding what this illness is and how severe it can be. It can be a game changer for people to really be able to understand it. And of course, I think it's incredibly empowering and necessary for you to understand what's going on inside your brain and your body in order to be able to navigate this recovery.